Hi, this is Kerry Shearer at the National Conference for Communication, Marketing, and Media in Atlanta for NPHIC. You know, one of the sessions that really fascinated me today involved pioneering activities on the digital frontier. Now imagine this, if you were able, with really no effort, to create a web page that pulled in all the specific federal and state data right onto the web page, but it was specifically localized for your area. That is the promise of work underway at the CDC.
So what this technology does, it allows it so that your visitors stay on your site. The content looks like your website. It's branded, it retains your brand, and yet we maintain the updates. So it's accurate, it's up to date, it's evidence-based, it's scientific. It's a good source. So we get to maintain it for you. I think it's pretty easy, but I'm a tech geek, but even that, a lot of the non-technical people say it's pretty easy. You simply go to www.cdc.gov/syndication. There's a storefront, you find the content that you want, and there's even an instruction video there. 3 minutes, it shows you how to do it. But essentially, you find the content you want, you say, I want it, you register, you select embed, it gives you the code that you need, and you simply paste, copy, 7 lines of JavaScript and HTML and paste it into your website, and that's it. What's available now is essentially 3 or 4 different storefronts. You can come to cdc.gov and get CDC content. You can go to fda.gov and get some FDA content, and some places at NIH and at HHS. We've just been working with the Ohio Department of Health, and they've stood up their own storefront. So what we're now starting to prove is that, say, a local health department in Ohio can get Ohio-specific information. They can get federal information. They can tie it with their local information. And so by doing that, we're breaking down several of those layers of government. We're providing the services directly to the citizen, regardless of the level of government that it originates on, right there in one single location. So what we're really working on, what we're really expanding this out to, is then working with Ohio so they can take, say, local information created by one of their local health departments and syndicate it across and let another local health department use that information. And then we're also breaking down what I'm calling the content type silos. We're not talking just about HTML content. We're also going to be doing video, audio, multimedia, infographics, data visualizations. If it's digital, we want to be able to move it. We want to be able to move it and reuse it in the public health system for all of us.
And back here in the exhibit hall at the NPHIC booth, lots of people stopping by the booth to get membership information, including a grateful public health communicator who expressed her appreciation to NPHIC for the scholarship that she received to attend this conference.
I'm very grateful to NPHIC for awarding me this scholarship. It was if I would be able to make it without the scholarships, I'm very grateful. I'm learning a lot here, especially about the new media, the marketing trends, and how we can use those at the Florida Department of Health. I've already been emailing my supervisor and my team members, just letting them know things that I've learned thus far, and I plan to give a full report and see how we can implement some of these things that I've learned. I actually am a member now with the scholarship. I was awarded a 1-year membership, and hopefully I'll continue that membership.
Yeah, we're over 500 members now, so I think the state of NPHIC is good, and it's great actually. And I didn't mention, but one of the things that I'm most proud of during my tenure is that we've also increased our tribal outreach. So we actually have 20 new tribal members as part of NPHIC. So this outreach is growing. Folks are seeing the value of NPHIC. I'm excited about the things we're doing on our website. We just started a Twitter page, and we have over 800 followers now. It's been exciting. It's been a great year. The staff at NPHIC have been working hard, filling some of the requirements out from our cooperative agreement with CDC. A lot of our activities are developing toolkits. We established a thought leader group that we share knowledge with our thought leaders, and then we discuss best practices. There are folks from academia, from healthcare, from public health, and they're all very high-level folks within their communicators within their field, and they're not necessarily communicators. They may have a special discipline, but they bring something important to the field of communication.
And speaking of communication, social media is a huge topic at this year's conference. I spoke with social media expert Valerie Daniel.
I work on the social media team with very talented, all women for some reason. We try to get guys in there, but you know, women are the health communicators. I get to work on health communication campaigns, if it's around a health observance or other initiatives. I also am a social media coordinator for Vital Signs, which is coordinates with the MMWR. It releases on the first Tuesday of the month, and it addresses a vital health issue and has a call to action to different audiences.
How has social media been a part of the Vital Signs outreach?
I would say it's been a huge part. We want to be where our audiences are. We want them where they're already talking, so that's why we got on Twitter. We just did our first Vine video about prescription drug overdoses for the last Vital Signs, and that performed really well.
Now that's interesting. It is tough to try and figure out, how do you pack something into 6 seconds? How did you do it?
Oh gosh, we used a data point that the program came up with about showing the skyrocketing rates of overdoses in women, and then we had a rocket on a graph, and it's only 6 seconds, and then we had the link to the Vital Signs issue for more information.
So what have you observed? What is going on in social media now? We've heard things about, kids are abandoning Facebook and they're going to other platforms. I'm just wondering what you could share with our communicator audience that you've been discovering over the last few months.
I think you're very smart to ask me about Instagram. As usual in social media, visuals are working great. Pinterest is huge with the female audience. There has been a little bit of Facebook fatigue is what they call it. The younger audiences are using Twitter more. There's a Snapchat app. I haven't really looked into it, which teens really like to use. So it's constantly changing. You basically have to figure out where your audience, what resources do you have, and which channels does it make the most sense to put your health messages on.
And that's it for today's update from the National Conference for Health Communication, Marketing, and Media in Atlanta. I'm Kerry Shearer for NPHIC.